Hello, and welcome to the We Talk Health podcast, the official podcast of West Tennessee Healthcare. I'm your host, Mobley, and on today's episode, we have Amy Garner here. She is the VP of our Communications Department here at West Tennessee Healthcare for the system, and we are going to be talking about all the great new things that are going on in West Tennessee. Thanks for being here, Amy.
Thanks for having me, Kara.
So this is your first time on our podcast?
I think so. If I was, it was way back when we just started the podcast.
It. Yeah, that was like 4 years ago.
I think that's
even
right. Yeah.
So tell everyone a little bit about what's going on with you lately.
Well, I am, as you said, the Vice President of Compliance, actually, and Communications for West Tennessee Healthcare, which means that I am in charge of our compliance program, and I'm also in charge of media relations and public relations, and I get to be the public information officer for the system.
So you've got a lot on your plate.
Well, it's very
juggling
diverse.
A lot of hats.
Yeah,
Yes.
yeah, very diverse hats.
So when you say public information officer, kind of tell us what that means.
Well, most people probably know me from going through the pandemic with me. And in that role, I'm really responsible for communicating with the public during an emergency.
Right.
But I also communicate with the public on a regular basis to let everybody know what's going on with our system. Like, all the exciting things that we have going on right now.
And that's across all of West Tennessee. That's for all of our locations and
absolutely. Yeah. I'm happy to go to any area, any community and talk about the great things we have going on.
Pounding that pavement.
Absolutely.
So we have a lot of exciting things happening in West Tennessee right now with West Tennessee Healthcare. So let's talk about the first one we want to talk about is the Henry County transition.
Absolutely. We're so excited about this. I mentioned to somebody the other day that I think that this is the busiest I ever remember in terms of like major projects that we have going on. So we've got, as of October the 1st, we hope to be bringing West Tennessee Healthcare up to Henry County to work with Henry County Medical Center. And we're going to be getting some new clinics and some new services up in that area. And hopefully we're going to keep healthcare in that community for many, many years to come.
Right, yes. And so for those of us who aren't sure, that's Paris, Tennessee?
Paris, Tennessee. That's right.
That's what I thought, but I was like, let me make sure.
Yeah, I used to live up there,
I don't
actually.
Get up that way very often.
Yeah, I went up there and lived right after I graduated from college. I lived up there for about 8 years.
Oh, wow.
And actually started working in our hospital in Camden, but I was still living in Paris at the time. So I feel like I'm kind of going back to my old stomping ground.
Back to your roots, yeah. So the next thing we've got, which is a really cool thing we just finished, so people should be seeing these commercials on TV coming up right about now, is our Heart and Vascular campaign.
That's right. We've got the biggest campaign that we've ever done in marketing is featuring our Heart and Vascular service line.
Right. Because
a lot of people don't realize this, but our Heart and Vascular team is the highest performing team in the state of Tennessee and one of the highest performing in the country,
right,
which is amazing. And we want to make sure that we get the word out, because if you have any kind of heart or vascular issue going on and you need services, we don't want you to have to drive to Nashville or Memphis, because we actually offer the highest quality care right here in Jackson, Tennessee. So we're very excited.
Right,
I've been watching the commercials every time they come on. I have to stop and watch them.
Right, yeah, right in our own little area here in West Tennessee.
Yep.
Which, that's very exciting. So we also have a new ion technology that is designed to detect lung cancer, which is the leading cancer for patients in West Tennessee, and it also provides like an early detection of lung cancer. So this is a really cool new thing. Don't ask me what ION stands for, but I know we've got a lot of pulmonologists that are excited to use this. I know Dr. Jonathan Davis is kind of spearheading that.
He's very excited. He's quite the champion for that, as well as some of our other pulmonologists that are in that department that are just touting this technology. It's like a robotic device that allows them to do a bronchoscopy and detect lung cancers with our patients. So we're very excited about that. And speaking of lung cancers, we have a screening coming up in November on the 9th at the West Tennessee Imaging Center, where you can call and make an appointment at 731-541-1742. And you can come in and be screened to see if you have anything going on with your lungs. A lot of people when they were younger did not realize the harmful effects of smoking. We live in an area where smoking is very common, and that's why lung cancer is so prevalent here. So we want to make sure that people get in and get screened because early detection is best for any kind of cancer. So we want
Right.
to offer that up for our community.
And especially it being the leading cancer for folks here in West Tennessee. And we just got several new pulmonologists coming on to our team. So
That's right.
that team has expanded. They just moved into what was the old cardiology building on Skyline. So that's a really great thing that they've got a nice big office. And cardiology, we can mention this as well, has moved to...
That's right. They've moved across the street on Forest Avenue to the medical office building where the surgery center is currently located.
Yes.
So your all of your heart and vascular services are now in one location, which is great for our patients. So they can see their doctor, they can get their test results, they can do all of that in one location over there across the street.
Yes, and that address is 700 West Forest Avenue, and cardiology's on floor 3. And the vascular services are on 4 and a few different ones, but I will add that to our show notes.
Yeah.
Some people are still moving over there. We're
Yeah,
still
yeah.
kind of in the process of that.
Yep. Lots of changes.
Yes. And another big thing we have going on that we're all working on as well is that Epic MyChart is going to be coming to our hospitals in addition to our clinics.
That's correct. So speaking of technology,
Yes.
we are upgrading our electronic medical record in all of our hospitals across West Tennessee on October the 4th and 5th, which hundreds and hundreds of people have been working on behind the scenes for the last year and a half, I think. It's a major project that
Right.
is taking a lot of time, a lot of effort, but it's going to be great. It's going to be great for our clinicians, and it's going to be great for our staff and our patients. And our patients are going to be able to communicate much more easily with their providers than they can now.
Mm-hmm.
So if you already have MyChart, the Epic MyChart, because you've been to one of our clinics, or let's say you've been to Vanderbilt for services, all of that information is in the same app on your phone. You can communicate with your providers. You can see your test results. You can make appointments, request refills. It's so easy, and I love the app. It's going to be great for all of our patients.
Yes, I have it as well. Like you can do virtual visits. You can schedule through there as well. And the good part about what's coming with the hospitals is any tests that you have done at either place will be accessible by your medical team at both places, so you're not having to have people fax and call.
Exactly.
And they can pull up your records from anywhere in a medical office.
Yep.
To see what you've got going on. Yeah.
It's going to be great for the continuum of care for our patients.
Right. And so the last little event we've got coming up, so we mentioned the lung cancer screening on Saturday, November 9th, but we've also got a breast screening as well.
Yes, it's for uninsured women, and it's going to be at the Kirkland Cancer Center on October 26th from 8 to 12. But you do need to call and make an appointment for that, and that number is also 731-541-1742. And you're going to see a lot of information in October regarding breast cancer awareness because it is Breast Cancer Awareness Month. So we'll have other events going on during the month as well. So be on the lookout, follow our social media pages, and befriend us on Facebook and all the platforms, and we'll be getting some information about all of that.
Right, yes. We've got Facebook, Instagram, we'll do some Twitter, but we've also got our West Tennessee Medical Group has a Facebook as well, and they post a lot of information on there as well. And finally, so next year is going to be a big year in the history of West Tennessee healthcare. It's going to be the 75th anniversary. So tell me a little bit more about that.
Well, I hope that we're going to have some exciting events planned during the year. Our 75th anniversary is actually August the 11th of next year. And in preparation for that, we are working on a corporate history book that should be finished sometime this year, maybe in December, that talks about the 75 years of service and how much we've grown through that time. We also are going to be featured in a documentary pretty shortly on public television. And so I've been working on that. It's a documentary that's called Viewpoint, hosted by Dennis Quaid.
Oh, wow.
So very exciting. Yeah, it's going to be a short form documentary that talks all about how we serve our region as a nonprofit organization. And we've grown over the years and all of the great things that we do in our community. So I'm very excited about that, and more to come on our 75th anniversary next year.
Right, yes. There's a lot been going on behind the scenes here. So
a lot of major things.
We're excited to start rolling some of these things out. And continuing the events that we've done, to help the community, because that's really what it's all about.
That's exactly right.
All right. Well, Amy, thank you so much for coming on. Do you have anything that I missed that I forgot to say?
Oh, there's so much I could talk about, but I don't want to.
We hit the highlights.
Yeah, I'll come back.
Yeah. Well, so we're going to try. This is the first that we're hoping will be a series where we meet with Amy and talk about all the great things that are going on in the community, probably quarterly or maybe.
Yeah, I think that sounds great.
To kind of give people information over the radio waves.
Sounds good.
Well, thank you so much for coming on and sharing all this great info.
Thank you. I appreciate it.
Thank you. Thank you for listening to We Talk Health. This podcast is not intended to replace any medical advice. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions or would like to request a topic, you can reach out to us at wetalkhealthpodcast@gmail.com.